Myers Counseling Group podcast. We offer mental health, substance abuse, and wellness information for the community. To find out more information and to access previous podcasts and other resources, visit us at myerscounseling.com. Hello, today I would like to welcome Melissa Inglese, an occupational therapist from Kids Therapy. Welcome, Melissa.
Hello, thanks for having me.
Melissa, can you tell us something about your background, a little bit of information about you?
Sure. I have my undergraduate degree in psychology from the University of Wisconsin-Madison, and then I got my master's degree in occupational therapy at Midwestern University, which is a health science college in Downers Grove, Illinois. And I've been in the field of occupational therapy for 9 years, and all of my time spent as an OT has been at Kids Therapy, where I'm currently employed, and I specialize in the area of pediatrics.
Excellent. And where is Kids Therapy? Where exactly is that located?
Kids Therapy, we are a private pediatric clinic located in Lake Barrington.
Excellent. Melissa, could you tell us a little bit about what an occupational therapist does?
Yes. An occupational therapist, in broad terms, basically works on restoring and improving functional performance in individuals, and also working on improving independence following an injury or resulting from a disability or a deficit in some specific area of functioning.
Excellent. So, what populations would actually, or what type of situations would people see you?
Well, an occupational therapist works with a huge variety of populations. We work from kids from birth to geriatric age. And a lot of times, you can see an occupational therapist following a specific injury, like an injury to your upper extremities. You can see an occupational therapist for pediatrics specifically resulting from a specific disability, such as autism or Down syndrome, or different kind of neurological disorders like cerebral palsy that kids may have.
What settings do occupational therapists traditionally work in?
Again, occupational therapists work in a variety of settings. More specifically, we can do hospitals, outpatient rehab settings, nursing homes. More specific to pediatrics, you can work in the schools or private clinics, such as Kids Therapy. Some occupational therapists also do home health, either in the geriatric population, or there's also a birth to 3 program that you can do home care for.
Oh, okay. If you could explain what a typical session may look like.
Yeah, each session is so different depending, because we kind of tailor the sessions to meet the child's individual needs and their goals. But a commonality in all the sessions is that they are very play-based, especially when you're working in pediatrics. You feed off the motivations of kids and what's meaningful to them, and that's play is kind of the general theme. And then you just we kind of tailor that to meet their individual therapy goals in terms of if we're working on fine motor skills, gross motor skills, sensory integration, whatever it is we're working on, then we meet those goals in a very play-based way.
Would you be able to give an example of with a particular situation a child may be faced with, let's say Asperger's? What would some of the techniques or sessions look like with that?
Sure. So let's say if we have a child that has lower muscle tone or strength. So rather than, especially if you're working with a child, you're not going to have them come into the clinic and, be lifting weights. So we want to try to motivate them to work on that, body strength. So we might do activities where we're doing games on the scooter board, or tug of war with ropes, or having them go up and down a climbing wall, or using a weighted ball to play basketball or catch. So different ways that you can work on that strength that's more meaningful to a child's life.
Excellent. And what you seem to be what you're presenting here is that although it may look like having fun, which they do, but there's also some therapeutic values that they're getting from these activities.
Absolutely. And that's why it's really important. A lot of times we encourage the parents to sit in on the sessions and to ask a lot of questions and for the therapist to be able to explain that although this does look like play, there's actually a very, specific therapeutic goal in mind. And then another good thing about that is then the parents can carry over these play-based therapies into the home, and they can be continuously doing them throughout the week versus just doing it, once or twice a week in a therapy session, so to really get carryover and achievement of their therapy goals.
And I understand working with these populations from my end that play is a very important part in engaging them, and there is, as you were saying, that there's some very therapeutic values that are attached to that.
Well, absolutely, and especially when you're working with kids, you want to build that relationship and that trust. And play is you need to get on their level. You need to get on the floor with them. You need to, literally, metaphorically and physically get in their level so that they trust you and you can build that relationship.
How would some of the roles that an occupational therapist have, how would that overlap with some mental health issues such as attention deficit, depression, areas that a mental health therapist may be working on or they may be struggling with? What role or how would an occupational therapist complement that?
There's so much overlap between occupational therapy and a lot of the mental health issues. Especially a lot of the kids that we treat have multiple diagnoses, so they might have an autism diagnosis and an ADD diagnosis, or they just have a lot of, behavioral issues that interfere with our ability to achieve our therapy goals because of maybe some noncompliance or different mental health issues that impact their ability to follow directions and comply to adult direction. So there's a ton of overlap. Even though we're not fully qualified, as much as a psychologist would be to deal with that, we inevitably have to do it in order to achieve our goals. So we have a lot of open communication between the occupational therapist and the child's, psychologist or social worker. And if there's not one in place, then we, refer out so that we can have those, both the whole team kind of working together to help the child. And also, a lot of things that OTs do is we work with kids, with it's called sensory integration. We work with their nervous systems to help. And a lot of the techniques that we do are very calming and organizing to the nervous system. So you take a child with ADD, and what we can do is we can, apply a lot of our strategies that help calm and organize their nervous system to help them cope with a lot of their, a lot of the challenges that the diagnosis brings. So we're not actually making changes in the diagnosis, but we're helping them to cope with the behaviors that result from it.
One of the important determinations for me in my evaluations and working in the mental health end is an I can't versus an I won't.
Mm-hmm.
That oftentimes when we're dealing with the younger population, they may not be able to quite articulate or have much insight into some of their limitations. I appreciate the fact that when you mention the sensory integration, a lot of times when I'm working with kids, we understand that there's certain things that may help, that may trigger certain behavioral events.
Yeah, absolutely.
And your ability in getting them to be able to, to address these issues are some of the ways that I see our roles overlapping.
Yeah, and that's probably where I get the most referrals from mental health professionals is for kids with deficits in the sense, they recognize the sensory piece, and so they will refer to an OT. And then same with us, we'll recognize some more of the behavioral pieces or things that as an OT I'm able to recognize in my sessions, but I don't feel fully confident treating. And so that's where you really get that really nice relationship between the mental health professionals and the therapist, the occupational therapist, to, really have a complete picture for that child.
Melissa, what are you looking for in the first session? What are you assessing?
When I do an assessment, when I initially see a family, a lot of my time is spent, talking with the parent and really, asking them about their concerns with the child. And I think that's a huge first step is that parent interview and, finding out what kind of things, what are the child's strengths? What things are they concerned about? What does the child's typical day look like, and what areas of that day might they have difficulty, functioning, whether it be in school, at home, or going out into the community. So I kind of like to just get a really good picture of the child and what areas are strengths for them and what areas they have difficulty with during their day. And then I also like to perform just some standardized assessments depending on, what information I've gathered from the parent, whether it be, having them fill out a sensory profile, whether it be doing fine motor testing or gross motor testing, and then also just, my own clinical observations of the child, watching them in play, watching them, engage with the equipment and the toys in the room and seeing how, they're just how well they interact with, with their environment.
How would this differ from physical therapy?
When you're working with pediatrics, there's a lot of overlap between physical therapy and occupational therapy, especially when you're working with kids. I would say that, the biggest distinguisher is that, in physical therapy, they work with larger motor skills, the development of, appropriate gait patterns, larger muscle movements, whereas occupational therapists work on smaller, more refined movement patterns, like functional hand use, working on activities of daily living and self-care. So they might work more on the functional activities, whereas physical therapists work more on the larger motor movements.
I see. Now, how would somebody set up an appointment with you?
With kids therapy, you would, if you just call our office, we can either, I bet the best contact person would be Jim Mortini, and he deals with all of our billing and scheduling. And if you give him a call, he can, set up an evaluation either with an occupational therapist, physical therapist, or speech therapist.
Excellent. And as usual, at the end of this interview, if you could leave your location, website information, and phone number, that would be great.
Yeah, absolutely.
Now, does insurance cover this?
Yes, we are in network with the majority of major insurance companies, and Jim works really closely with families to, help get insurance coverage. And then if for some reason insurance does not cover the therapy, then he works with families to either set up payment plans or provide some sort of financial aid if needed. But typically insurance does cover the therapies.
Great. Melissa, we covered a lot of different areas here today, and I appreciate your time in giving us some information and insight into what an occupational therapist does.
Yeah.
Would there be other information that we may not have covered that you think would be helpful for the audience to know?
I think that we covered a lot of stuff. I would just, encourage families that if, they have any concerns about their children, to feel free to, to know that there are resources out there that can help. And kids therapy does free screenings. And so if you have a concern, but you don't really know if it's, requires a full evaluation, you can always call the clinic and we can do, free screenings to kind of let you know. And then there's also that big piece too of socialization and, just social skills and with peers. And that's another thing that we do here at Kids Therapy is we have a lot of social groups and recognize that need to help facilitate. A lot of kids do really well one-on-one or do really well with adults, but then when you get them in a room with kids, it's, a whole different story. So we also offer groups for our kids as well.
Great. And what age groups would you have those groups for?
We kind of form those groups on an as-need basis. So right now we have groups for 2 and 3-year-olds, and then we also have groups for kids between 4 and 6 years of age. And then we used to have some groups set up for some older, 8, 9-year-olds, and that. But I don't think that group's going on anymore right now, just because the need hasn't been there. But like I said, we just form our groups on an as-need basis, and then if we have another child and match, then we put them together. So.
Great. Excellent. Now, Melissa, again, one more time, if you could let people know how they may be able to contact you, what your address is, your website, and as well as your phone number.
Yes, absolutely. We have two clinics. We have a clinic in Libertyville, and we have a clinic in Barrington. The Barrington clinic, the address is 22285 Pepper Road, Suite 301.
Mm-hmm.
And that's in Lake Barrington, Illinois. The phone number here is 847-842-0597. And then would you like the Libertyville clinic information as
Yes,
well?
please.
Okay. The Libertyville clinic address is 1860 West Winchester Road, Suite 108. And then that's Libertyville.
Great. And do you have a website too?
Yes. You know what? Let me give you the Libertyville phone number, because that's where you can contact Jim Mortini.
Okay.
That number is 847-573-9486, and he's extension 10.
Great.
And then our website is www.kidstherapyonline.com.
Melissa, again, we appreciate all the information you've given us. It was very helpful.
Thank you very much.
And again, thank you for your time.